Hi, I'm Justin Riley. Today on Wisconsin Doctors, it's time to start thinking about health insurance again. The marketplace is wide open, and if you are like so many other Americans, undoubtedly you have a few questions about health insurance. We're here on location at Bluff Medical Center here in Mauston to get those questions answered. Whether it's questions about health insurance, Medicare, or just plain billing, you'll want to stick around for today's episode. My guests will include Carol Thomas, who is the certified application counselor for the marketplace here at Bluff. Lisa Ammerman, Medicare specialist here on location at Bluff Medical Center, and Chris Loy, the director of clinic patient accounts. It's all coming up right here on Wisconsin Doctors. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center here in Mauston, and typically we're talking about healthcare related topics. Today we're talking about health insurance, and it's a great time to be doing that as open enrollment is now underway. And I'm going to talk to our panel a little bit. I'll start with Chris. Chris, can you give us a rundown of what types of insurances or insurance coverage is available for individuals?
Sure. There are major categories of insurances that are available. We have commercial insurance that you might be eligible for through your employer, through your group employment, or you as an individual can go out and purchase insurance on your own, or you can do it through the marketplace. There are patients who qualify for Medicare, and Medicare beneficiaries can choose to have coverage through the original Medicare
Sure.
Program that is administered by the federal government.
Sure.
Or they can choose to go into a Medicare Advantage plan, which is a private insurance company that will administer their benefits. There are also coverages available for individuals through the Medicaid program, and that's a state policy. And the state will assign those patients either to their standard coverage, which is administered by the state, or again to a managed care policy, which is a private insurance company, and they will administer their Medicaid benefits.
See, I didn't know that. I didn't know that there was kind of like it seems like there's like a public and a private version of Medicare and Medicaid.
Yes.
So, wow, okay,
yes,
that's interesting. It's good to know. Carol, I'm going to jump over to you. So obviously we're hearing a lot more about enrolling in the health insurance marketplace. That's open now. Can you tell viewers who should enroll and how that's supposed to be done?
Well, anybody who doesn't have insurance right now should get on the open market. That's open until January 31st of 2016. They can apply online, they can call a 1-800 number, or they can give us a call and we can help them through the whole process. But there's several insurance companies out there and you can get it for an affordable price.
Absolutely. And Lisa, we know that Medicare is it's open enrollment for Medicare right now as well. How can you tell viewers how that they can enroll for Medicare?
The Medicare open enrollment period, what that is basically is for patients who are already on Medicare to look at their coverage plans, their supplements, their drug plans, if they're on an Advantage plan, and decide if it's still affordable for them or if there's something maybe more cost effective for them out there. And the open enrollment is till December 7th, and they have until that time to change their plans, and those plans then will take effect January 1st. So if they decide that they need to change it up a little bit, they have that time to do it, so it takes effect the first of the year.
You said December 7th.
December 7th, yep, is the last day to get that changed for it to be effective January 1st.
Okay, great. And Chris, healthcare billing can be confusing if you don't understand terminology. Obviously, when I get a bill in the mail for healthcare, sometimes I don't always understand everything that I'm seeing. Can you walk us through what a copay, a deductible, and a coinsurance are? What are the differences?
Sure. We do get that question quite often in our office. Why didn't my insurance company pay this bill for me? So the copayment is really an agreement between the patient and the insurance company that the patient is going to pay the first, say, $20 of any certain services that you might have. And then the insurance company will pay or negotiate the payment for the balance. A co-insurance is usually based on percentages. So the patient agrees to pay, say, 20% of the first part of that service that they received, and the insurance company will pay the other 80%. A deductible is upfront payment that the patient has to pay before their insurance company will kick in and start paying any claims for them.
Lots of good things to talk about. We got to take a short break, but when we come back, we're going to be talking a little bit more with our panel about health insurance. It's a great time of year to be talking about that. It's Wisconsin Doctors. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center in Mauston, and today we're discussing health insurance and trying to navigate our way through that system. And next we'll be talking with Carol Thomas, who is a certified application counselor for the Affordable Care Act. In other words, she's a CAC for an ACA, for the ACA.
Correct.
Welcome, Carol. Thanks for having us here today. So tell us exactly what that means, being a certified application counselor.
Well, it basically just means that I can help people enroll in the marketplace. We really encourage them to try and do as much of it on their own, but if people are struggling, they can always give us a call and we can help walk them through it, or even sit down with them and go through the application process with them.
So now, are you based here at Bluff then?
I am. There's actually two of us. I work actually out of the clinic, and then there's another girl that works out of the hospital, so we kind of cover each other if one's not here or busy doing something else. We've both had to go through the same training to be certified. Every year we have to go through follow-up training because laws have changed and things change. And obviously they've learned a lot in the last 3 years with the Affordable Care Act, and things have changed.
Yeah,
so.
absolutely. And it's so great that somebody can call and talk to somebody local, versus going to a call center or something like that. So that's nice to know that you're there.
Yeah. So what are some of the things that you talk to people about and encourage them to look at that when they have to choose what insurance they want to take?
Well, I always tell people that they should make a list of what's the most important thing to them. If they're more important is the cost, deductibles, premiums, or is their most important things the medications they're on, or they prefer a specific provider. Then when they do go out to the marketplace and actually view the insurance companies, they can compare those a little easier when they know what they're really looking for, especially if somebody's on a lot of medications. You want to look at the prescription tiers. If they're very happy coming here to Bluff Medical Center, then they need to look into which insurance companies they can actually come to. So it does take a lot of comparing. I recommend people make a list, sit down with a cup of coffee in their pajamas, relax in front of the computer, and start comparing.
Or a glass of wine.
I suppose depending upon the time of day.
Right, yeah.
So if someone had coverage either this year or had later in the year, throughout the year with the marketplace, do they need to re-enroll, or is there something they need to do for this next upcoming year in 2016?
Well, if they've been on the marketplace before in previous years, they don't have to do anything. They can be automatically re-enrolled. But I do recommend that people do go out and actually update their information and look at the new insurance plans that are out there, because they do change. The premiums go up, or maybe they weren't happy with the one they had. And the other part of that in actually updating their information is to make sure that they're calculating in their premium tax credits that they might be eligible for and things like that with current information. So I always recommend they go out there. If you don't and they automatically re-enroll you in a plan, it's a plan that might be similar or the exact same plan, and the premiums could be more.
Yeah.
So
Now, updating that information, I think, and keeping that current is really important,
Yep.
for sure.
Yeah. So what happens when what is the deadline, and what happens if they miss the deadline?
Well, the deadline is January 31st, 2016. Once that open enrollment's over, it's pretty much over unless you qualify for a special enrollment period. And that would be if there was a life change. So for instance, you lost your job and now your income's lower, or you had a baby, or you got married, or you got divorced. Then at any time throughout the year, you can actually go on and get insurance because it's a life change, something's changed.
So what happens if I just didn't apply for insurance at all and I just wasn't covered then?
Well, there are penalties out there, and the penalty has gone up every year. This year, the penalty is $695 per person.
For the year?
For the year.
Okay.
But it's $395 per person. So if you're in a family of 5 and you have 2 adults at $695, children are $395. They're under 18. That could turn out to be quite a hefty penalty. There is a cap on it, of course. It can only go to a certain amount and things like that. But yeah, there's penalties out there if you don't get insurance.
Yeah, so get out there and get insurance. Well, Carol Thomas, thank you so much for the information. When we come back, we're going to be talking about Medicare with our Medicare specialist, Lisa Ammerman. Don't go away. There's more Wisconsin Doctors coming up right after this. Hey folks, welcome back to Wisconsin Doctors. We're here on location at Bluff Medical Center here in Mauston, and next we'll be talking with our Medicare specialist, Lisa Ammerman. Lisa, welcome to the program.
Thank you.
So can you talk to viewers a little bit about the differences between traditional Medicare and, say, a Medicare Advantage plan?
The difference, they're both Medicare programs. The difference, the traditional Medicare is run by the federal government. A Medicare Advantage plan is basically a policy that a person will get through like a commercial insurance policy, and it works like a commercial policy. It still has to cover at least the minimum of Medicare benefits. A lot of times they do cover a few more things that Medicare doesn't cover, which is, I guess, probably where the name Advantage Plan came from. They have some vision policies that you can take out, or dental policies and things like that that Medicare doesn't normally cover. So I think that, you know, some patients do look at that to have that extra coverage that might help them a little bit along the way.
So these are private companies that are basically meeting the Medicare requirements set forth by the government.
Correct. Okay. Yep. They have to, that's the minimum. They have to minimum pay the same and, you know, cover the same things that traditional Medicare covers. Most of them do that plus some additional services. So.
Got it. Got it.
And can you tell me a little bit about what Medicare does cover as far as like preventative care?
There are several different preventive care services that they have. The first one that I would talk about is the Welcome to Medicare visit, which is the first one that patients are eligible for in their first 12 months of Part B coverage. It's a face-to-face exam, so similar to what people call their annual physical, if you will, with their commercial policy. Now they have this Welcome to Medicare visit, and then it is not an actual physical exam, it is just a face-to-face visit. So the provider will go over your medical and social history. They'll look at some risk factors for like depression or mood type disorders. They'll look at your functional ability at home, safety things to make sure you're safe there. They do some of the same things that you'd see at your other visits, your height, weight, blood pressure. They'll look at your BMI. They do a simple vision screening test. And then if the patient is up to it, they will maybe do some discussion on end-of-life planning. And they'll just maybe give them some information on that. And then based on all of those previous answers, then they'll do education, counseling, any referrals that might be needed for that. Then there's also a a Medicare annual wellness visit, which this is for patients who are outside of that 12-month Part B coverage. Very similar to the Welcome to Medicare visit, is they cover all the same items in that visit, but then there's also a couple things that they add. They look at a personalized screening list that you might be eligible for in the next 5 to 10 years. So look at, are you due for a mammogram, colonoscopies, prostate type exams. And then they also like to get a current list of your providers that you see maybe outside of our facility here, They also are going to look at suppliers that you might have if you're an oxygen or diabetic, to suppliers that you might use, and then pharmacies that you have, so that way we have the current information here, so if you need something, we always have that information right here for you.
And are those Welcome to Medicare visits available here at Mile Bluff?
They are. Yep.
Excellent.
Any of our providers are eligible to do those. There is no requirements for that as far as specialized training or anything. So any of your providers that you see here can do those services for you.
Excellent. That's good to know.
So what happens when a patient comes in for a preventive or a welcome to Medicare or something like that, and they have a medical issue that they want to discuss on top of that?
If they have something like that, it's what they call a problem-related visit. And there can be additional charges with that. The Welcome to Medicare and the annual wellness visit are something that Medicare will cover 100%. So if you also need to talk about a problem that you have, whether it's a new problem or a chronic problem, there will be additional charges on that. And it's a national standard for that type of service to happen. Some patients like to do that as a separate visit. Some do it the same day, but they just need to be aware that there could be additional charges that they may be responsible for because it's not part of that specific visit.
Lisa Ammerman, Medicare Specialist here at Mile Bluff Medical Center. Thank you so much for joining us today.
Thank you for having
It's
me.
great having you. Don't go away. When we come back, we'll be talking more with Chris Loy, who is the Director of Clinic and Patient Accounts. We'll be right back with more Wisconsin Doctors. And welcome back to Wisconsin Doctors. We're here on location at Mile Bluff Medical Center here in Mauston. And next, we'll be talking with Chris Loy, Director of Clinic Patient Accounts. Welcome, Chris.
Thank you.
Thanks for having us here today. So what advice would you give patients if they are preparing for a medical appointment? Let's talk about that a little bit.
Well, I'd say from an insurance standpoint, the most important thing that they should be doing is calling their insurance company or reading their insurance policy, because there can be restrictions in where they can be seen and what they can be seen for in order for their policy to cover them. And it can be really confusing. So the people at the insurance company are there for a resource, and we are also here for a resource, so we can help them through that too if they want to give us a call and see if they can be seen in our clinic or one of our specialists that come into the clinic.
That's pretty comforting to know that there's people on both ends, both on the insurance end and on the medical end, that will assist with aspects of insurance coverage. So
Yeah, absolutely. And when they do bring come into their appointment, if they bring all of their medications with them, but also please bring your most current insurance card,
Right.
Because a lot of times there's a lot of information on there that might conflict with what they're telling us, and we would need to see that in order to give them the correct information.
Yeah, absolutely.
Yeah.
I know there's a lot of insurance plans out there. Can you tell me what insurance plans we accept here at Mile Bluff Medical Center?
Well, there are a lot of insurance companies that we have contracts with. Some of them are the bigger plans that we have coverage with as Unity Insurance, that's connected with Madison, Gunderson Health Plan, connected with La Crosse, Security Health Plan, Marshfield, but we also have Anthem Blue Cross, WPS, WVA, and many more. You're more than welcome to, again, give your insurance company a call to make sure that we're in your network, or give us a call and we can let you know that too.
So once the patient has a bill and they maybe have to make payments, what kind of options do they have, or what help might be available for them when they have those bills?
Well, we have a really great team in the department that have specialized information about commercial insurance, Medicare, Medicaid, and self-pay help for patients, so they can give us a call at any time that they might have a question about their bill. They can also ask a question through our patient portal if you are signed up for that, which is a really good resource that we have available for us. If you want to make a payment, you have the options. Of course, we'll take cash, credit card, checks. You can pay online, and a lot of people do internet banking, so you can do that. We have a secure billing website that you can go to and also pay your bill in that way.
That's very good. And now I'm just curious. We have a little bit of time left here, and you mentioned a couple times commercial insurance. I'm just curious to know. I mean, when I picture commercial insurance, I picture insurance not for an individual but for like a company. But that's not the case at all.
Oh no.
Can you talk to us a little bit more about what exactly is commercial insurance?
Well, commercial insurance they're private insurance,
Okay.
private companies that provide insurances for individuals, and it could be through a group, such as an employer.
Got it.
But you can go to an insurance agent if you're self-employed, or if your particular employer doesn't provide insurance,
Sure.
or again, you can go through the marketplace
Yeah.
and purchase commercial insurance as well.
So commercial insurance is just the private company that provides the insurance.
Correct.
Got it.
Correct.
Got it. Okay. Thanks for setting me straight on
Sure.
that. I appreciate that. So if someone has a question about a bill, what can they do? You gave a couple of examples, but can they talk to somebody here?
Absolutely, yes. Yep. You can give us a call. We have our direct numbers listed on the back of our statement, so if you have a specific Medicare question, you can call Lisa directly, or a self-pay question, you can call Carol directly. Medicaid, we have a Medicaid person. You can call the general number at any of our clinics and dial 4, and you'll get our department, and we can certainly help you through any of those. Or you can stop into the clinic, and we'd be happy to meet with you.
Excellent. Well, Chris Loy, Director of Clinic Patient Accounts, thank you so much for joining us today. Thanks for the information.
Thank you.
I also want to thank Carol Thomas, who is our expert on enrolling folks in the marketplace, and also Lisa Ammerman, who was our Medicare specialist. They've been great today. Thanks, folks. I appreciate
Thank you.
it.
Okay, thank you.
That's all the time we have for Wisconsin Doctors from all of us here at Wisconsin Doctors and CW57. We invite you to live longer, live better. We'll see you next time.